If you are diagnosed with ovarian cysts and you are worried about what it means, here are 5 facts you need to know about ovarian cysts and how we doctors understand and manage these ovarian cysts when we are planning an IVF cycle for the patient. First fact is that even normally functioning ovaries can produce ovarian cysts. So there are cysts which are of different kinds. They can be follicular cysts, they can be corpus luteal cysts, also called hemorrhagic cysts. These are all medical terms which we use to diagnose what type of cyst we are seeing on ultrasound. So if they are these follicular cysts or corpus luteal cysts that we are seeing on scan when we are planning an IVF cycle, we do not prefer to start the IVF treatment right away. So that is the second fact, and that is in the presence of these cysts, we will want to delay treatment for some time till these cysts naturally regress. That is, we wait for them to naturally dissolve or we give medication to our patients so that they can dissolve quicker. The third fact, why are we bothered about the cysts? As I just mentioned, they interfere and have an effect on the response of the ovary in the IVF cycle, and also they produce certain hormones which can interfere with the response and can interfere with the blood tests which we perform during an IVF cycle. The third point, that there are some cysts called as endometriotic cysts or dermoid cysts. This again is an ultrasound diagnosis on based on the position of the cyst, based on the size of the cyst, based on various other factors, we may want to surgically remove the cyst before going in for an IVF cycle. So, depending on the type of cyst, we may either give medication to help the cyst dissolve, or we may delay the treatment cycle, or we may suggest surgery for the patient so that these cysts can be removed and the ovarian response in the IVF cycle is better. Now, there is a fifth point which you need to understand is there are some cysts which do not look healthy at all. Now, these are the cysts where we will not want to do IVF, we'll want to do some blood tests, and we may want to postpone the IVF cycle and surgically try to understand, remove the cyst and understand what is the type of cyst which we are dealing with, and only later on think about an IVF cycle. So please do not worry if you have been diagnosed with an ovarian cyst in the start of your IVF cycle or just before your IVF cycle, because most of the time they are harmless and it only means that maybe your IVF stimulation is going to be postponed for another few weeks or maybe another month or so. And you do not worry, do not panic. Please understand that your body knows best when is the time for us to stimulate that ovary for IVF. What you can do is just stay calm, remain positive, maintain a healthy lifestyle, a healthy diet, a healthy weight, and just be calm and accept that there is an ovarian cyst which is delaying the cycle, and just wait for things to get better because your body knows best when is the right time to start our IVF treatment. Hope this information was helpful to you, and if you have any other further queries, we'll be happy to answer it. Just drop in a comment and we'll try to answer your query ASAP.